Hello, welcome back to my channel. If you're new here, my name is Zainab Mukhtar. Today we are going to talk about the silent infection. In the last video we talked about STIs and I listed some of the STIs, and we also talked about the 3 most common STIs in Nigeria, which are, so if you've not watched the last video, I think you should before watching this one, but you can also watch this one and watch it later. You're going to see it, you just have to click on it really. So the 3 most common STIs in Nigeria, as we talked about in the last video, are chlamydia, gonorrhea and syphilis. But it's not just in Nigeria actually. Like, it's the most common STI in UK, it's the most common STI in, I think, in New Zealand or so, like in so many countries, like worldwide it is a big one. And one of the problems with this silent infection is that 1 in 2 men that get chlamydia do not have symptoms, and 2 in 3 women that get chlamydia do not have symptoms. I know you're probably wondering, like, what causes that, where does it come from and stuff like that. So the name of the bacteria that causes chlamydia, the disease, is Chlamydia trachomatis. You don't need to keep that in your head seriously, it's just for your information. The bacterium is passed through vaginal, anal and oral sex, and it also can be passed from mother to child during childbirth. So you can get chlamydia in your eyes, you can literally have sore throat and you will not know that it's chlamydia. The common symptoms of chlamydia, really for a lot of people that have symptoms, are difficulty urinating for both men and women, as well as some very weird discharge, like it could be green or anything weird. The symptoms when they occur could be difficulty urinating, you can get sore throats, and you can also have eye infection. So all these things I'm telling you do not replace information from your doctor. So see your doctor and ask them about these things. That is their job, for goodness sake. Like, their job is not just to prescribe medicine and then you go. When you see a doctor, like, bombard them with questions. I do that because they have all this knowledge that you actually need, and yeah, they also like give you information that's tailored to your needs. There are factors that make you more prone to getting chlamydia. Being sexually active before the age of 25, having multiple sex partners, not using condom correctly or consistently. Like, you don't just use it once and not use it again. You have to use it all the time. Having a history of sexually transmitted infection. Like, you can have multiple STIs at the same time. So you cannot just say, oh, I tested positive for gonorrhea, I definitely don't have chlamydia. You can have both chlamydia and gonorrhea at the same time. So usually when you test positive for one STI, it's recommended that you actually do more tests. Yeah, you can definitely speak to your doctor about that too, to see like which other tests you should do. It's likely that you have to do a HIV test or like gonorrhea test and stuff like that. The surest way for you to prevent chlamydia infection is by abstaining from sex. Stay celibate for the rest of your life. Apart from abstaining from sex, there are other ways, like there are other things you can do to prevent chlamydia infection. Use condoms consistently and correctly every time you have sex. That is one way. However, you should also know that condoms, even though like they can be up to 90-something% effective when used correctly, do not eliminate your chances of getting sexually transmitted infections. Limit your number of sex partners. As long as you have sex, you are at risk of having sexually transmitted infections. The more sexual partners you have, the higher the risk. Get regular screenings. Okay, this, guys, is very important. I've said it in the last video. You need to test. Like, there's no way of knowing right now that you don't have an STI if you don't test. It's possible as you are watching this video, you have an STI. Guys, seriously, the only way for you to know that you don't have an STI is to get tested. If you're a woman 25 and under and you're sexually active, you should get tested for chlamydia every year. See your doctor. If you don't bring it up, it's very likely that they won't, because they don't know your history, like they don't know that you've also watched my video. So talk to your doctor about these things, request for information, and also request to be tested, and then they will tell you the best test for you, and then you get tested and you are safe and the world becomes a better place. Avoid douching. So what douching does to you really is that it kills the good bacteria in your vagina. So when it kills those good bacteria, they're supposed to be the soldiers fighting away disease for you. Those diseases that have been lurking around somewhere waiting to enter your body will enter. So women are more likely to get chlamydia than men. They're also more likely to have more complications from chlamydia than men. However, men can also get like very, very serious complications from chlamydia. So you see, one of the issues with this infection is that it doesn't show symptoms quickly. So it can be there, eating you up, like growing, doing whatever it wants to do in your body, but it won't show you any symptom that will make you feel like, oh, something is wrong with me, or I need to see a doctor. This infection is also very easy to treat. As we know from our COVID lessons, I know a lot of you actually got to learn during COVID that viruses are more difficult to treat, bacteria is easier to treat. I think some of you heard it during this COVID situation. So that's true. This is a bacteria and it's easier to treat than viruses. So when you get tested early and it's detected, right, it's easy to treat it. But when it stays in your body for long, it can cause really life-threatening situations. So as I said earlier, like both men and women can have like serious difficulty urinating, or like very, very painful urinating situation, and they can also get, both men and women also get weird sort of discharge. But like when it gets to the next stage, it can cause infertility in men. Chlamydia can cause infertility in women as well. It can cause pelvic inflammatory disease when it gets to your uterus. It can cause ectopic pregnancy. It can literally threaten your life and that of your unborn child. Also, like if a pregnant woman has chlamydia and she gives birth, the child can get the infection as well, like especially through their eyes. And yeah, so sometimes like you see that the child will be born with some color of eye. I'm not saying that every baby born with a discolored eye has chlamydia, or the mother has chlamydia, but yeah, like that happens as well. In the next video, we are going to talk about how to use a reusable sanitary pad, how to wear it, how to wash it, how to dry it, and how to store it as well. Trust me, you don't want to miss that video. Like, I'm going to share a lot of tips and tricks that I'm using right now. Thank you guys for watching this video. I hope you've learned something new from it. I learned a lot during the research for this video. Subscribe to my channel if you aren't already, and I'll see you in the next video. Thank you.